Hello, welcome to my channel, Life Talk with Dr. Chioma. I just want to use this opportunity to say Happy New Year to you because this is my first time of doing a health talk this year. So, Happy New Year. Also, I want to thank the over 100 subscribers we have on this channel. Thank you for listening to me. Today, we're going to continue on our series on contraceptives, and we're going to talk about the hormonal contraceptives first. And I call this contraceptives the culprits of modern contraceptives. Okay, so at this juncture, if you are not subscribed to this channel, please go down and click on the subscribe button, and do not forget to like this video, if you really like it. And then another thing is, if you think this will be beneficial to someone, please share this video on your timelines or your social media pages, so that it will help someone to make an informed decision about their health, to help one woman today to make an informed decision on their health. So what are hormonal contraceptives? They are contraceptives that contain artificial hormones that are made to mimic our body's reproductive hormones. Okay, so they're made to mimic this our body's hormones in order to bring about contraception, in order to prevent pregnancy. Our female hormones are responsible for reproduction are the progesterone and the estrogen. So these hormonal contraceptives contain these hormones, and that is how and those are the products they use to prevent pregnancy. How do these hormonal contraceptives work? The first thing they do is they prevent ovulation. That means they stop egg from being released. Secondly, they're going to thicken cervical mucus so sperm cannot swim through and come and fertilize an egg. Thirdly, they are going to thin the line of the uterus or thin the lining of the womb, so that even if there is a fertilization, there will be no implantation, there will be no promotion of growth of the fetus. There are actually different types of hormonal contraceptives, and it's mostly saying based on the areas where we are living. Okay, the first one, which is common everywhere you go to, is the pill. So the pill is taken every day at the same time, so you have to be very careful when you're taking the contraceptive pills. So they're taken every day and at a particular time. So if you miss any day, so it's very user dependent, meaning that it depends on you for it to work. So you have to remember to take it, and you have to remember to take it at a particular time. So we also have the hormonal skin patch. This is like a patch that is placed on your skin, maybe chest, back, different parts of your body. You can place it on some parts of your body, so it releases, and you're supposed to change it like weekly. So when you put it, it releases these hormones and prevents pregnancy. We have a vaginal ring that is usually placed in the vagina, and is put in there for like 3 weeks, and then it is taken off for 1 week. That should be the week you have a period. So this ring is just put in and releases hormones to prevent pregnancy. Another one that is very available in Nigeria are the injectables. These ones, they are injections you take, into the muscle, and it is released slowly into your bloodstream, gently, and they last for either 2 months or 3 months, depending on your choice. Okay, an example of these injectables is the Depo-Provera. I'm sure if you have gone, to a family planning clinic, you must have been told about it. So Depo-Provera lasts for 3 months, and when you get it, you can just relax and not worry about pregnancy for like 3 months. Another group of hormonal contraceptives we have are the implants. These ones, they last for 3 to 5 years, depending on the one you choose. So they are mostly put on the upper arm, just below your skin, and from there they keep releasing hormones slowly, so you can put it there and relax for 3 to 5 years. You don't have anything to worry about concerning pregnancy. So another group of contraceptives we have is the intrauterine device, which is the Mirena. This one is also common, especially among some women that have finished giving birth. They prefer this, when they don't want to do the permanent one, they can go for this option. So this Mirena, it could last for about 5 years or more, and it's inserted into the womb or the uterus, and from there it releases the hormones and does its work of contraception. Reason why I call hormonal contraceptives the culprits of modern day contraception is because they are hormones, and they're going to have effects on our bodies where our normal hormones have effects. So the side effects or the adverse effects are very visible, and that is why most people complain about them. One of the side effects a person can see is absence of menstruation. This is usually seen with people that are using the IUD, the Mirena. So if you're someone that is not bothered whether you see your menstruation or not, then this method probably might be for you. If you are like some people that want to be free of the period, yes, this method might be good for you if you're not bothered about it. Then second, we could have prolonged bleeding. Prolonged bleeding is usually seen with the injectables. After your period, maybe you continue bleeding or something like that. So you continue bleeding after your period. It's almost like you're seeing your period all throughout the month. There is no stopping. So this is seen mostly with injectables. Another side effect is irregular bleeding or intermenstrual bleeding. That means between your period you could have some spotting, some dropping of blood. So some people have complained about this too with the use of hormonal contraceptives. So if you're a woman, you probably know of this side effect I'm talking about. This has been very notorious with hormonal contraceptives. This is what most women complain about whenever they're using hormonal contraceptives, and that is weight gain. As women, our weights are very important to us. We want to still look sexy after having children, still look sexy no matter what we're doing, and if there is a risk of weight gain, most women are going to complain. So this is the most notorious, the very notorious side effect of hormonal contraceptives that keep most women away. Even though weight gain has been said to occur in very small percentage, but it is still a valid fear in the heart of every woman that is told about it. So because these contraceptives are hormonal, we have to be very careful while taking them. So that is why you need to be properly advised by a gynecologist or a family planning expert before you make a choice of using hormonal contraceptives. There are some things you need to look out for. There are some risks that if you have, you'll be advised not to use hormonal contraceptives. Okay, so you need to look out for these things whenever you want to choose hormonal contraceptives. You're advised not to use hormonal contraceptives if you have an increased risk of blood clots. Some risk could include age greater than 35, if you're a smoker, if you have had a blood clot in the past, then this contraceptive might not be advisable for you. Above 35 is not like an exclusion factor. It's just one of the things that has been described as a risk for increased clotting. Also, if you have had a risk, or you have had an estrogen dependent tumor in the past, like uterine cancer or breast cancer, most times you're advised not to use the hormonal contraceptive, because the hormones from these contraceptives are going to work on those tumors and you could see a recurrence. If you're someone that has been bothered with abnormal menstruation, your menstruation is not normal at all, it doesn't come regularly, and it's just not going the way it is supposed to go, then this contraceptive might not be for you, because one of the side effects, it makes your menses irregular. So if you already have an abnormality with your menstruation or your cycle, this contraceptive might not be advisable for you. For some people, we have to monitor them if they are placed on this, especially those at risk of stroke, meaning those that have that are living with hypertension, that's high blood pressure, or people living with diabetes mellitus, or people that are on medications for seizures. So these people are at risk of having a stroke. So most times they are properly monitored if they are placed on hormonal contraceptives. So you will have to work hand in hand with your cardiologist, your neurologist, and your gynecologist if you want to use hormonal contraceptives. Another people at risk when using hormonal contraceptives are those with liver disease, because the liver acts as a cleanser for the body. It removes toxins, it clears drugs from our systems. So if the liver is not able to work, then some of these hormones may have prolonged effects in our bodies. The last contraceptive I'll talk about under hormonal contraceptive is the emergency contraceptive. This some of us know it as Postino 2 in Nigeria, and some other places they have a plan B or something. So this is emergency contraceptive. It's supposed to be taken when mistakes happen. You mistakenly have unprotected sex, spur of the moment, something like that. And another time is like maybe when other methods of contraceptive fail, like you have a broken condom during sexual intercourse, or you forget your normal contraceptive pills, you forget to take them, and you have unprotected sexual intercourse, then you can take the emergency contraceptive. And it is supposed to be taken for it to be effective some hours after sexual intercourse. Postino 2 is within 72 hours of sexual intercourse, or else it will not be effective at all. You will fall pregnant, yes, if you take it after 72 hours. Another thing is, it's not something to be taken all the time. So if you find yourself taking Postino 2 every other day, then you need to look for a better and a longer form, form of contraception. Okay, so some of the side effects that someone could get from taking Postino 2 regularly, irregular menstruation. It could shift your menstruation off, it could bring it closer, it can make it irregular, then it could like sweet. It is not sweet. Postino 2 is not sweet. No, it's not paracetamol that you take for headache. So please, let us be wary. So also note that if you take Postino 2 and within 2 hours you vomit it or throw it up, know that you've not taken anything, so you have to repeat it. Okay, so please take note. Yes, I know some people have recorded side effects with hormonal contraceptives, but a lot of women too are also using this hormonal contraceptive, the different methods, and they are working very well for them. It's just for you to choose, to weigh your cons, to weigh your benefits against the risk, and decide whether you want to use this contraceptive or not. I hope we have learned today, and I hope some of us will try not to demonize hormonal contraceptives. You can try it out if you think it will work for you. Okay, just make sure you're making an informed decision. Thank you so much. Till next time, thank you for watching. Bye.